on the first segment of the program this morning, we're touching down on our health, not just any part of the health, but we're going to be doing something about skin diseases. So we're looking at skin diseases as a global health concern. And joining me in the studio this morning, Dr. Olufolakemi Cole. She's a consultant dermatologist with the Lagos State University Teaching Hospital, and she's right here with us. Dr. Cole, good morning.
Good morning.
And how are you doing?
Lagos. I'm doing great. Thank you.
All right. So let's talk about this. So skin diseases, is it a health challenge? A global health challenge?
Absolutely. Skin diseases affect about 1 in every 4 to 6 people worldwide. And some data from, Africa has shown that 4 in every 10 visits to the outpatient departments are due to skin diseases or skin concerns.
Right.
And so, yes, it shouldn't be overlooked. We are very happy that the World Health Assembly has recently passed a resolution that recognizes skin diseases as a global public health priority. And so we need that to get more attention and more awareness for skin health and skin diseases.
All right, so the skin is usually, once we see somebody, the first connection that you want to see is the skin, right?
Absolutely.
But beyond that, what we see, from a dermatologist perspective, how would you define the skin?
The skin is the largest organ in the body. It actually takes up about 10 to 15% of our body weight, and it's the only organ that we can see. You can't see your liver, your kidneys, or your brain, but everybody can see your skin. So your skin is like an ambassador for your whole body. It's also a reflection of your health, your state of health, and in many cases, the skin is the window into the body, and where there are internal issues in the body, it can reflect on the skin. The skin is also a social organ, meaning that it displays beauty and is what people see and can be attracted to you or not be attracted to you.
Right.
And so it's important to take good care of your skin.
So what are the skin diseases that we have?
Common skin diseases in this part of the world and in most parts of the world, the number one would be acne, pimples, breakouts. We also have inflammatory skin conditions like atopic dermatitis, we have seborrheic dermatitis, we have keloids in us Africans where we have scarring, and then we also have things like urticaria. Then we also have a lot of infections, fungal skin infections in adults and children, bacterial skin infections more commonly in children.
Right.
And these are common skin conditions that we see almost on a daily basis.
Right. And is this skin conditions you mentioned now, is it also discriminatory? Does it say this is more prevalent in blacks, more prevalent in Caucasians? Is that the case?
Well, things like acne are common in everybody.
Okay.
But there are a few things that are more common in blacks. For instance, keloids. Most people with keloids are skin of color or darker skin. And then you have a lot of infection because of our climate. The fungal skin infections and bacterial skin infections are also more common in this part of the world because of the humid climate, which favor the growth of these fungi. So we do have a large burden of certain things here. In the Caucasians have a large burden of skin cancer, which we don't have because of our melanin, which is protective.
Okay.
We do see skin cancer in people with albinism, but for the most part, we don't see skin cancer so commonly in us black skinned people. Okay,
so for once, at least I've heard some good news about blacks, because a lot of times
black is beautiful.
When I hear of those diseases, they seem to discriminate against the blacks much more than the whites.
Our black skin is very, very it ages slower because of the melanin, and it has more protection against the sun. Not complete protection, but enough to reduce our risk of developing skin cancer.
Right. So skin diseases, are they very, very, how would I put it? Because a lot of time when we talk about cancer, we talk about other kind of diseases, there's always so much fear, so much kind of complications that are attached to it. So are skin diseases that complex too?
Well, they can be complex, but most skin diseases will not lead to death. But they do affect your quality of life, and we find that a lot of people with skin diseases have the same amount of impairment of their quality of life as people with cancer or severe condition because they don't feel confident, they feel depressed, people looking at them or discriminating. For instance, someone with vitiligo that has patches of white patches all over the body, people will be running away from them. And so the discrimination and stigma that comes with skin diseases is what really makes it important. And then in some cases, it can affect the ability to gain employment.
Right.
Because if the skin condition is so obvious, people will not want to hire you.
Right.
And if you don't have a job, you can't sustain yourself. It's quite devastating.
Dr. Cole, what causes skin diseases?
Well, it depends on the type of skin disease, the different things. Number one, I would say infections can lead to skin diseases. Some of them are irritations from the environment. Some are genetic, meaning they are passed down and in the lineage. Some can be due to what we call autoimmune, where the body is fighting itself for reasons we are not completely sure of. And some can be caused by drugs or exposure to toxic substances or medications, and some can be due to the climate. The weather can also cause certain skin conditions.
So talk about pimples, for instance. I mean, I know lots of people come down with pimples here.
Yes,
so
about 85% of the world will have pimples at one point in time or the other. It comes with hormones, adolescence, and it's also associated with excess oil, a bacteria that lives on the skin that overgrows, and then the body responds to it and causes inflammation.
Right.
And sometimes dead skin cells get stuck in the pores in the skin.
So is it true that when we consume granules, too much granules, it could lead to pimples?
There's no evidence to that, but there's some evidence that high sugar foods can worsen pimples, not cause pimples, but if you're eating a lot of refined sugar, it may aggravate or worsen pimples.
Right.
But pimples is not due to lack of hygiene. It's just something that occurs in most people from adolescence and up until adulthood.
Is it curable?
It's not curable, but it can be managed.
Or it just goes on itself?
For most people, it goes on its own, but it's good to manage it so that it doesn't leave scars.
On the face.
Because if you don't treat it properly when it's there, even when it goes, the scars will still remain. So it's important
talk to our ladies
treat
out
it.
there. I mean, the young girls out there. A lot of times they are touching their face. No. Let me press it. There's the pimples there.
No, pressing can lead to further infection and scarring. It's better to see a dermatologist to get appropriate treatment. Gentle cleansers is what we recommend. We have specific treatments for pimples. Don't go using strange things like toothpaste or engine oil on your face in a bid to treat your skin conditions. Try to see an expert, and each person's treatment will be tailored to their specific concerns. So
let's talk more, because I'm going to be talking more to the ladies this morning. The concept of bleaching has been around for several years. Absolutely. You are a dermatologist. Talk to me. Is bleaching healthy?
Yes,
Is it healthy?
Absolutely not. We should be proud of our color. Whatever color we find ourselves in is beautiful. What we need to do is try to take care of it. When we try to lighten our skin artificially, it comes with a myriad of problems, which don't usually start immediately, but eventually those problems lead to severe, not just on the skin, but in the internal organs, depending on what agent is being used for skin bleaching.
Yeah, but Dr. Cole, this lady wants to look fine. That's why she's bleaching.
You can be beautiful in any color. Look at Mercy Johnson. Is she not beautiful?
Right.
Yes. Look at Lupita Nyong'o, who is a Kenyan. She's dark skin, chocolate, beauty. I think what we need to do is stop thinking that the only people who are beautiful are people who are fair. Everyone is beautiful in their skin tone. You don't need to be light skinned to be beautiful. Your skin can glow and shine in whatever skin tone is.
So the concepts are a little bit different. So some will say bleaching. What about toning? I mean, is there anything like that?
It's nothing like that. It's just they just use that one to make it sound better. I've never seen a cream that they wrote bleaching on it anyway. They are all toning, but the toning is they are bleaching.
Right. So it's not good at all.
No. So what I would say is, some people say, "Oh, I was lighter. I want to maintain my color," in quotes.
All right.
But what we recommend is, one of the things that causes people to get darker is the sun. So you can use a cream called a sunscreen, which will reduce tanning. So the parts of your body exposed to the sun, a sunscreen will help to reduce or minimize darkening of those areas.
So why are dermatologists campaigning against those kind of creams? I mean, why are they made?
We campaign all the time, but we don't have the power to stop them, we try to engage with regulatory bodies. We do a lot of advocacy. I'm always on social media, on Instagram, on Facebook, talking about the dangers of skin bleaching, and we were playing our part with advocacy to try and educate people and encourage people to love their color, whatever color it is. Especially the issue with children. Now, mothers trying to bleach their children is a big problem, and we try to discourage them and say, please do not.
In fact,
it's a problem.
Yeah, so
dermatologists, we are meeting up to also discuss how we can further help educate Nigerians
on
and
that.
Yes, and
all right, we'll talk about that.
Week.
And that question I just threw to you is coming in from Boyega is also sending a question in that regard. Boyega from Ikorodu. Boyega, good morning. Says says good morning and happy new week. Your side mirror crew. Is it true that bleaching cream can contribute to long-term skin damage or disease? If yes, why isn't more being done about it? Boyega from Ikorodu. Boyega, thank you so much. I think the doctor just touched on that.
Yes.
All right. This one says, good morning, Victor. There is a growing pandemic of self-trained or improperly trained and unauthorized soap and cream makers.
Absolutely.
Especially in Lagos. He said their products often do more harm than good. Why can't the government step up enforcement to take action against such individuals? If you're in, send that one. If you're in, thank you so much. So, have you noticed that as well? Those kind of
Yes, we have. So when we see our patients, we ask them to bring in what they are using, and a lot of people are bringing in these mixed creams, organic soaps, homemade creams, something the salon person mixed for them, and it's so dangerous because these people do not have the knowledge of cosmetic science, of safety, and the importance of safety controls and checks for things that we put on our skin. Yes, the skin is a barrier, but some of the things we put on our skin are absorbed into the skin, and so it can do internal damage. So we need to be very cautious. I wouldn't advise anybody to use any cream or soap that doesn't have proper labels, that doesn't have a NAFDAC registration, and that doesn't have the actual ingredients listed on it. It's very dangerous to do that.
All right. Lagos Traffic Radio 96.1 FM. Question here says, Dr. Cole, what do you have to say about modern day mothers that start using whitening creams for their infants? Yetunde is sending that one in.
It's so concerning, and we are trying as much as possible to do advocacy. If you follow me on Instagram, you see I'm constantly talking about the dangers of using whitening creams, particularly for children, because their skin is so absorbent. It absorbs half of the things that go through it and can lead to organ damage, growth problems, growth restrictions. We've seen a child who was not growing properly because the bone plate was affected by the steroid that the mother was using on the child, in the child's skin,
which is very unfortunate.
We've seen other children developing kidney failure because their mother was using a lightening or toning cream that contain mercury. So we have to be very, very careful. Okay,
then flash update coming in from the control room says there's a breakdown. This is where now? Pen Cinema, yes. Breakdown of an empty 6-tired gas truck having mechanical fault. This is at Okekoto, inwards Pen Cinema Bridge. Ongoing efforts for evacuation, but structure still very much on ground, trying to ensure that you can move. All right, so take note of that. Okekoto, inwards Pen Cinema. There's a broken down 6-tired truck there, which is affecting traffic. All right, so Dr. Cole, what are the signs? What are the symptoms that will show that the skin is having one or two challenges?
So usually there could be symptoms like itching, redness, discoloration. In some cases there could be breaches like open sores. In things like acne, you have breakout, the spots on the face. Sometimes there could be scaliness and dryness. That's the skin barrier is damaged, and so there are scales, and in some cases you may also have some oozing of fluid. That's what we call weepiness.
Right.
And in some cases, the skin just gets swollen, like in hives or urticaria. You just see swollen like someone flogged you on the skin. That's a sign of urticaria, which can be an allergic reaction.
Right.
So the skin can, have various symptoms. But what I always advise is early diagnosis and treatment is always best. So once anybody has any symptoms, please try and see a dermatologist.
Let's begin to round this up. Right. I hear you guys are coming up with something. The dermatologist?
Yes, we have our annual conference of the Nigerian Association of Dermatologists this week in Lagos. Lagos is hosting all dermatologists in Nigeria.
Do you have enough of you around?
Well, we have about 120 dermatologists
in Nigeria. That's abysmally small.
It is small. That's like 1 to 2 million people. We are hoping to train more dermatologists and get more medical students interested in dermatology. So our conference is going to be talking about dermatology and global health, bridging the gaps in dermatology, and also why we need to train other people apart from dermatologists on how to manage basic skin conditions because of our short numbers.
So you need to go into schools now. Let's see how we can show up the numbers. And I've seen more female dermatologists. What's going on? Is it that it's the only medical profession that is very suitable for women?
No. I think it's because there's more of the aesthetics and beauty. Although dermatology is beyond that. We do have male dermatologists too, but I think the women also like it, so they know how to take care of their skin.
So is ratio what, 64?
Probably, yes, thereabouts.
So I seem to get the figures right. All
yes.
Right. So where is this conference holding?
It's at the Radisson Blu in Ikeja, which is going to be from the 25th to the 27th of June. That's this week, Wednesday to Friday, yes.
Oh, okay.
And we have lots of dermatologists and other health workers coming in. We have didactic, scientific presentations, and also we have a lot of panel discussions about things we spoke about today, like how do we curb the issue of skin bleaching, how do we regulate the aesthetic environment where people are just making creams on their own without training. And we hope that we'll also be able to encourage and inspire young doctors to want to become dermatologists.
All right, Dr. Cole, we'll get you in very, very soon so that we can talk much more. There's a whole lot of enlightenment that we need to do about skin diseases and how we can really, really curb the increasing numbers.
Yes.
Well, Dr. Cole, it's nice having you in the building.
Thank you so much for having me, and good morning, everyone.
All right, then. So on the program, we've looked at skin diseases as a global health concern, and Dr. Olufolakemi Cole, who is a consultant dermatologist with the Lagos State University Teaching Hospital, has taken us to the classroom. A short break. When we return, we'll connect with our friends on how we can volunteer for our communities. But guess what? It's all about LG rhythms. They'll be coming in shortly.